Director of Americans for Prosperity, North Carolina, and I am not willing to allow a government bureaucrat to decide what I am worth. I am not willing to let a government bureaucrat decide what you are worth. I'd like to thank Sandy and Randy Davis for letting us be out here at their dealership today. And I asked them to pull this bike over here, and I've kind of molested it while it's been over here. Smelled it. And you know what I smell when I see that bike? Freedom. I smell and see freedom. The idea you can get on the open road, go left, go right, go north, go south, and nobody has the right to tell you which way to go. Just like nobody has the right to tell you what kind of health care you're entitled to. Now, Randy may not agree with me, but I think some of these bikes here, speed is the essence, right? A good speed. Well, we were out at the Concord Harley-Davidson dealership today, right down the street from the Speedway, and I was talking about speed being the essence at the track there as you take that car down the fourth turn, down the back straight into the finish line. But speed is the enemy in Congress. They are on a lightning speed to get one of the worst pieces of legislation in modern American history through before anybody reads it, including themselves. As you know, Washington is trying to take over your health care. It's not enough that they took over the banks, the insurance companies, and the auto companies. Now they want to control your health care. Politicians actually want the power to decide who lives and who dies. President Obama and many of his allies in Congress have begun a coordinated attack on the rights of individual Americans in the name of health care reform. Now, we know what that health care reform means. Big new bureaucracies, the eventual elimination of private health insurance, forcing us into a one-size-fits-all government plan, and new, huge, job-killing taxes to pay for it all. As recently as 2007, President Obama openly supported a Canadian-style single-payer system. Now let's talk about that system. Recently, a man from Canada needed a hip replacement, needed a new hip, and he went to the statist big government plan, and they said, "Look, you're too old to justify the surgery. You're just too old. You need to wear a brace the rest of your life." Ladies and gentlemen, he was 57 years old. Now, I'm just going to guess there's some people that about that age here. Now, it's not just Canada and Britain and France and other places where people talk funny. It's happening right here in the United States. And if you don't believe me, ask a woman by the name of Barbara Wagner. Barbara Wagner lives in the state of Oregon. Oregon has a big government statist-style health plan, the same style that the president and the leaders in Congress want to export to all of America. Now, Barbara Wagner came down with a type of cancer, a little bit more of a rare kind than some others. Her doctors recommended a new set of chemotherapy drugs. And the Oregon State Health Plan wrote her back and said, "Look, we're not so sure about that." Unfortunately, at least I think it's unfortunate, the state of Oregon has a doctor-assisted suicide law. So not only did they deny her chemotherapy drugs, they told her that if she wanted medicine to end her own life, they would prescribe it and send it to her. Oh my goodness. It can happen here, folks. Now, Barbara Wagner is alive today because she got charity care. But if it had been up to the statist regime in Oregon, she'd be 6 feet under. They wanted to take Barbara Wagner's liberty and freedom away. We can't let them do it to you. We have to send them a clear and resounding message. And it's printed on those signs, it's printed on that bus, and it's printed on those fans. Hands off my health care. Get those signs up, get those fans up. Hands off my health care. Hands off